Assalamualaikum and greetings to Dr. Nasruddin and our fellow classmates. So today my group consists of me myself, Dr. Hakim, Azri Azim, and Muhammad Aiman and also Ahmad Safwan will be presenting on the topic low back pain. So for the first part, I will be presenting on the pathophysiology of low back pain. So the definition for the low back pain, there's a different definition according to the sources. So according to the European guideline for prevention of low back pain, it is defined as pain and discomfort that is localized below the coxal margin and above the inferior gluteal fold with or without leg pain. Another definition by Acute, which resembles the European guideline, is that the low back pain is pain that occurs posteriorly in the region between the lower rib margin and proximal thigh. And low back pain, most common form is the one that called non-specific low back pain, and is defined as low back pain that not attribute to recognizable non-specific pathology. And the area that is the common affected by the low back pain is the back structure, which stand of the lumbar or the lower back region that made of the 5 vertebrae, which is the L1 to L5. But sometimes the low back pain will also affect the sacrum. And between these vertebrae, there are fibrocartilaginous discs which act as cushion that prevent the vertebrae from rubbing together while at the same time protecting the spinal cord. And there's nerve that come from and go to the spinal cord through specific opening between the vertebrae, providing the skin and the sensation to our muscle. And the stability and the spine around the area is provided by the ligament and muscle of the back and abdomen. There's also a small joint called a facet joint, and that function to direct the motion of the spine. The muscle located at the area is called multifidus muscle that run up and down along the back of the spine. And the muscle is important for keeping the spine straight and stable during many common movements such as sitting, walking, and also lifting. And commonly, the problem with low back pain involves this multifidus muscle because the back pain causes the person to use the multifidus muscle incorrectly to avoid low back pain. Commonly, the problem with multifidus muscle continues even after the pain goes away and be the main cause why the low back pain comes back after intervention of the low back pain. So for the low back pain examination, the main aim of this examination is for the patient that presented with back pain to classify according to the diagnostic triage recommended in the International Back Pain Guideline, which if there's serious low back pain such as fracture, cancer or infection, and also specific cause of back pain with neurological deficit such as radiculopathy, caudal equina syndrome. But this syndrome is rare, but it's important to screen for this condition and make sure that the intervention is correct for the correct type of low back pain. When the serious and specific cause of low back pain have been ruled out, the individual are said to have a non-specific low back pain, or also known as simple or mechanical back pain. Non-specific low back pain account for over 90% of patients, presenting to the primary care, and these are the majority of the individual with the low back pain that present to the physiotherapy. And the assessment aims to identify the impairment that may have contributed to the onset of pain or increase the likelihood of developing persistent pain. That include this also include the biological factors such as weakness and stiffness, and also the social factor, which is the work environment. And the common symptom for low back pain. In the common presentation of acute low back pain, the pain develops after movement that involve lifting, twisting, or forward bending. And the symptom may start soon after the movement or upon waking up the following morning. So for the first one is the dull and aching pain. This symptom remain within the low back pain or that is usually described as dull and aching rather than burning, stinging, or sharp. And this kind of pain can be accompanied by mild or severe muscle spasm, which limit the mobility and also ache the hip and pelvis area. And for the next one is the pain that travel to the buttocks and leg and feet. Sometimes the low back pain include a sharp and stinging sensation that move down the thigh and into the low leg and feet. This sensation, also known as sciatica. Sciatica is caused by irritation of the sciatic nerve, and it is usually only felt on the one side of the body. The next common symptom is the pain that after prolonged sitting. Sitting put pressure on the disc and causing the low back pain to worsen after sitting for a long period of time. And usually, walking and stretching can alleviate the low back pain quickly, but returning to the sitting position may cause the symptom to return. And the next one is the pain after waking up, but usually goes away after moving around. Many of the patients experience low back pain after waking up first thing in the morning. And after getting up and moving around, the symptoms are relieved. This symptom may caused by the stiffness due to long period of rest and decreased blood flow to the low back area. Next. Now we move on to the causes of the lower back pain. The first one is the muscle strain and ligament sprain. This is usually happen. This can happen suddenly or can develop slowly over time from a repetitive movement. This usually involve the multifidus muscle, which occur when the muscle is stretched too far and damaging the muscle. And also sprain happen when overstretching and tearing the affected ligament which connect the bones together. The main cause of the sprain and strain include that lifting heavy object, a sudden movement that places too much stress on the lower back area, and also the poor posture over time. The next is the bulging or ruptured disc, or also known as herniated disc. There's a jelly-like center at the lumbar disc that can break through the outer layer of the lumbar and irritate nearby nerve roots. The herniated portion of the disc is full of protein that can cause inflammation when they reach the nerve root. The next one is arthritis. Arthritis is a condition that results from wear and tear of the disc and also facet joint. It can cause pain and inflammation, instability, and stenosis to a variable degree and can occur at single level or multiple level of lower spine. Spinal osteoarthritis is often associated with aging and is slowly progressive, and it also referred as a spondylosis or degenerative joint disease. And the last one is osteoporosis. Osteoporosis Osteoporosis is a condition where the density of the bone osteoporosis is a bone disease that occurs when the body lost too much bone and make the bone less dense, or the bone is reduced. As a result, the bones become weak and brittle. There is often cause fracture and breakage.
So, moving on to acute and chronic lower back pain. Okay, next. So, all this all this information that I start from this article for a low back pain acute from Greg, Mythos and Hamilton in 2009. So acute pain is usually last a short time for injury. Pain that lasts less than 3 months or pain directly related to tissue damage is called acute pain. Low back pain is pain, muscle tension, stiffness, and localized below the costal margin. And next. So, a non-specific low back pain is a term some people use to indicate back pain, non-attribute to a recognizable pathology or symptom pattern. Next is acute low back pain with symptom or sign at presentation that suggest a specific underlying pathognomonical condition. And lastly, duration into acute injury is less than 6 weeks, and subacute injury is within 6 to 20 weeks. So there is three type of acute lower back pain injury. First is instrait spine. So this instrait spine has a few of injury, but I state for three first. So first, lumbar sprain, spinal stenosis, and spondylosis. So for lumbar sprain is diffuse. The sign of lumbar sprain is diffuse back pain, with or without buttock pain, worseness with movement and improvise. So next stage is systemic. So there is three: cognitive tissue disease, malignancy, and osteomyelitis. So for connective tissue disease, the sign of that is multiple joint arthritis, fever, weight loss, fatigue, spontaneous process, tenderness, other joint tenderness. And lastly is referral. So is abdominal aortic aneurysm, hep, hep, herpes and prostatic. So for prostatic, the sign of the injury is discomfort in lower abdomen, pelvis, or hip. Next is for chronic low back pain. So, chronic low back pain continues after tissue healing. The term chronic pain is generally used to describe pain that lasts more than 3 to 6 months or beyond the point of tissue healing. This type of pain benign pain or chronic non-cancer pain, depending upon the situation. Chronic pain due to cancer is more of an acute or acute recurrent type of pain, since there is ongoing that identifiable tissue damage. There is also chronic pain due to identifiable cause, which will be discussed subsequently. So chronic pain is usually less directly related to identifiable tissue damage and structure problem. And lastly, chronic back pain without a clearly determined cause, failure back surgery syndrome, continued pain after the surgery that has complete heal, and fibromyalgia are all example of chronic pain. Chronic pain is such much less well understood than acute pain. Next. So there is a differential diagnosis of chronic low back pain. So we have four. First, non-mechanical. So at non-mechanical, we have spinal cord tumor, inflammatory arthritis, septic discitis, disease of bone. And second, we have referral pain. At referral pain, we have prostatitis, chronic pelvic, and renal disease. So we can see that for this chronic, for prostatitis, that is same injury that we have acute at referral acute low back pain. So if become that 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 type of injury can become a chronic low back pain injury. So third is mechanical, osteoporotic fracture, herniated disc. And lastly, we have uh, idiopathic, which is a very chronic injury, is lumbar sprain. That's all.
Okay, so we move to the type of exercise for the lower back pain that we can use for our daily life. So next, for exercise is as a tool of the rehabilitation, which is personally prescribed set of exercise that range from the active movement through to the strengthening exercise using the such as the TheraBands, body weights, and resistance machine or free weights. Depend on the needs of the client condition and the finding during assessments. So for us, a strong core is not just about the abdominal, but for our lower backs muscle, matter to the these muscles stabilize the spine and contribute to the healthy posture. Most of the people who have the back pain naturally feel better while doing the certain motion. Some people feel the better sitting, which is their back and hips are flexed. Others person also feel the better standing, which is the back and hip are extended. So the exercise we move toward become a more comfortable position is usually more successful in treating our back pains. A lot of exercise that we can apply is our life to overcome the lower back pain problem. So, according to the Smith et al. 2011, which their research article's title is the effect of the lumbar extension training with the without pelvis stabilization on the lumbar strength and the lower back pains. So, their main exercise is the lumbar or the back extension exercise. So they are suggest for the us as a normal persons and the active persons to do the repetition and sets at least 12 repetition and 3 sets. So the one lumbar extension training session must do only 1 week for the 12 weeks. So why we choose the lumbar extension exercise for the patient lower back pain? This is because we want to the performing the back extension exercise. We increase the ability to coordinate the movement through the lower back pain, which is targeted the 3 point for the erector spinae, such as the ilioscostalis lumbrums with the lower part, spinalis thoracic with the middle part, and longissimus the thoracic with the top parts. So the second rationale is the positive lead to the better overall back posture and important for the prevention of the back injury. Next. So for the summary of these articles, the repetition will perform slowly with the 2 seconds taken to lift the weight and the 4 seconds taken to lower it. So second, it's performed more than if the people or the participant that perform more than 12 repetitions, so the weight or intensity will increase by approximately the 5% of the weight load. So the lastly, statistically significant improvements in the lumbar extension strength in reducing the lower back pain in the chronic patients. Next. So we move to the second article, which is a study done by the Kongs et al. 2014. Next. So as you all can see, there are 3 types of the exercise, but they use the 3 type of the bridge, which is the front bridge exercise or plank or front plank. Second, the supine bridge exercise on the Swiss ball. Third, the supine bridge exercise. So in this article, they recommend to do the 3 sets and 5 repetition for the each exercise. So 30-second work for the bridge and 30-second rest period between the sets. So they do the 3 days per week for the lower exercise for the lower back extension. Total of it to show the positive effect at least the 8 weeks. So the rationale of the exercise for the lower back pain is to improve the trunk muscle stability among the patient with the lower back pain. Second, purpose of the trunk stability exercise is to protect the spine from the recurrent the micro damage of the muscle, pain to the spine instability, and the degenerative change in the spine or the erector spine and erector abdominis. So summary of the article, 3 exercise group shows the significant change in the transversus abdominis, internal obliques, and external obliques using the ultrasound of the exercise compared to the thicknesses before the exercise. That show the article shows that the 3 type of the exercise is very effective for the patient that have the lower back pain. Lastly, the front bridge exercise is the most efficient for the improving the trunk stability and increase the trunk muscle thickness compared to the supine bridge exercise in the patient with the lower back pain. Next. So we move to the according to the Calatayud et al. 2019 with the title of article tolerability and muscle activity of the core muscle exercise in the chronic lower back pain. So in this article, they have the 2 type of the exercise that focus to the lower back pain, which is the squat and bird dogs. So they just give the rep and sets, which is the 5 repetition maximums and 1 sets and 5 repetition per side for the bird dog and 1 sets. So so the rationale of this article I have see from the others article, which is the bird dog and squat, is the reduced lower back pain. So they have the four rationale, which is the help to improve the muscle coordination and balance, can stabilize our spine while walking and running, encourage the neutral spine and relieve a low tension for the back pains. Lastly, is strengthen the core, hip, and back muscle, which is the lower risk of the injuries. Next. Okay, focusing to the summary of the articles. Acute effect of the core exercise on the activation of the muscle core, such as the rectus abdominis, internal obliques, and erector spines. So using the EMG to detect the active muscle in the erector spine, the squat and the bird dog exercise provide the greatest numbers of the between exercise statistically differences for the erector spine, which is the 40% and 29% compared to the others exercise such as the torso twice, modified curls up, lateral knee plank, and lateral planks. In conclusions, squat and bird dog exercise are especially effective in the activating and strengthen the lumbar erector spine for the chronic lower back pain people and low percentage to get the lower back pain injury again. Next. So we move to the Chow et al. 2014, with the title of the article Research Effect of the Core Exercise Program on Pain and Active Range of the Motions in Patient with the chronic lower back pains. So they have the three exercise that you all can see, which is the firstly the double knee to chest, laying spinning twist exercise, and cobra exercise. So the core exercise program for the duration of the core exercise program is the 30-minute per session. So they do the 3 times a week. So the total core training program is overall of the total core training program is 4 weeks. Next. So for the summary, the core exercise program to the chronic lower back pain patient and shows that there is significantly effective in resolving the pain and improve the range of motions. Second, the core group shows the significant decrease in the pain at the rest and during the movement compared to the dose in the control group using the visual analog scale and pain pressure threshold or PPT. So the core exercise program, which was used in the study control tension of the lumbar pelvis hip joints, which maintain the lumbar stability to strengthen the muscle, increase the endurance, and the correct posture. There also the rationale why we must to do the core exercise. So in conclusion, this study confirmed that the core exercise program applied to the patient who has the chronic lower back pain was effective in the reducing pain and increase the range of motion. Next.
So moving on to considerations when prescribing to musculoskeletal patients, there are many considerations that we need to take into account when prescribing exercise to this population. So before I go into that consideration, what is musculoskeletal system? Musculoskeletal system includes the bones, skeletal muscles, tendons, ligaments, cartilage joints, connective tissue, vascular and nervous tissue. But the big portion of this musculoskeletal system is the muscle as well as the bones as well as the skeletal muscles. And any injuries or disease related to these parts of body is considered musculoskeletal disease or injury. And it has been said that exercise therapy is a safe method for improving patients' physical performance and elevating the symptoms of various diseases. So moving on to the consideration itself, according to a review paper by Hoofman, where in this review paper they focus on osteoarthritis of the hip and knee, chronic non-specific low back pain, and other chronic conditions. So the general consideration in prescribing exercise to this population is that, first of all, a proper assessment has to be done prior to the exercise. Patients need to get a green light to exercise, and so that they are clear from any contradictions or other things. The second one is supervision. Throughout the training, there need to be supervised by professionals, exercise professionals, so that the exercise is performed in a safe environment with a safe exercise given with a safe range of intensity and reps. Third one is to educate this population on the exercise program and how it can benefit them. Next is to health professional needs to understand the patient's fear and beliefs. By knowing their fear, health professionals can tackle what actually they need to help on the patients. Some patients may be afraid of doing exercise, so they need to educate this population that exercise is actually good for their conditions and all. And lastly, incorporate strategies to enhance training adherence. This is the important part, which is to sustain a long-term training for this population. So health professionals need to put in effort in incorporating strategies that can help them adhere to that specific exercise program. Next, they outlined some consideration when prescribing exercise to osteoarthritis patients. First of all, they need to educate the patient that exercise does not harm their joints. Secondly, exercise should include muscle strengthening, aerobic training, as well as range of motion exercises. And these exercises can be performed whether on land or in water, doesn't matter. For chronic non-specific low back pain, some of the consideration that need to be taken into account is the main types of training should include motor control exercises and graded activity. First of all, they need to focus on the motor control exercise. Why? Because we need to, the goal is to retain and the control of the trunk muscles, posture, and movement patterns. And once this has achieved, they can move on to the graded activity, which is to improve the patient's ability to complete functional activities. So when performing motor control exercises, again, detailed assessment of recruitment of trunk muscles, posture and movement pattern, as well as the breathing technique should be emphasized. And when moving on to graded activity, the health professionals should address patients' physical impairments such as reduced endurance, muscle strength, and balance. Well, these populations could be afraid of training, might be because of their pain, so they might not train or exercise for a long period of time. So this part, health professionals should address whatever physical impairments that they have. They need to address and try to improve these impairments. Next, again, consider the psychological barriers to activity resumption. Fear, like the general consideration, understand the fear. So the health professionals need to know what are their psychological barriers so that they can tackle it and try to help them with it. And lastly, the progressions in training should be made upon time dependent other than pain dependent, because pain will always be there. So it is a matter of playing with intensity or volume, and it should progress by time, not by pain, by referring to the pain. Next, so the Health Ministry of Hong Kong has come out with exercise prescription doctor's handbook, where in this handbook, they provided prescription and consideration of exercise for different population, including with those having osteoarthritis and osteoporosis. And some of the considerations outlined by them are as follows. Again, assess the patient before participating to any activity. The training should be supervised by health professionals. Moderate intensity should be prescribed that do not cause more pain to this population. Strenuous exercise should be avoided when acute flare-ups and periods of inflammations. They need to perform weight-bearing and low-impact exercises. They should also avoid exercises involving twisting, bending, or compression of spine. Adequate warm-up and cool-down should be incorporated so that the pain can be reduced. They need to progress in training duration rather than intensity, as I mentioned, like what mentioned before. Progression should be met by time, so training duration. Patient should be educated on the pain or discomfort occur. An example of educating is if the pain occur 2 hours after training, it is okay. But if continues, the intensity or duration of the training should be reduced. Painkillers can be used during the first week so that it helps in exercise compliance. Patients should be encouraged to exercise when pain is less severe. They encourage water-based training as it helps to avoid further pain and joint destruction. And exercise or health professionals should promote weight loss and exercise adherence to obese patients. Next, an article by Smith and others, musculoskeletal pain and exercise, challenging existing paradigms and introducing new, where in this article they focus on the mechanisms related to musculoskeletal pain and how this proposed mechanism can actually benefit painful exercise over pain-free exercise in people with chronic musculoskeletal pain. Some of the considerations that they incorporated or suggested is to understand what the patient understands about the pain. The health professional needs to understand what the patient actually knows about the pain. Next is to challenge unhelpful belief. Exercise safety, exercises which suitable or not performed. So they need to clarify these things, their belief, the patient's belief on the exercise itself. Health professionals should provide safety cues. They need to educate the patients on the exercise done. They also need to provide advice on suitable level of pain. If there's pain that is tolerable, they can still perform it. If not, the intensity or volume needs to reduce. And provide advice on exercise modification. Like before, If the pain level is intolerable, volume or intensity needs to be reduced, and do not stop exercise as it will not improve the condition. Another article from Luan and others where they outline exercise as a prescription for patients with various disease. In this article, they provided exercise prescription for many diseases, including musculoskeletal diseases such as low back pain, tendon injury, osteoporosis, osteoarthritis, and hip fracture. And some of the considerations outlined for this exercise prescription for this population are, again, evaluation. They need to conduct a comprehensive evaluation for patients, exclude all possible contradictions. They have to select appropriate type and intensity of exercise for this population so that further contradiction does not occur. Keep an eye on the patient's adaptation to the intensity of the exercise. So more or less the same, supervise. So keep an eye. And lastly, follow the principle of gradual progress. Start low intensity and progress gradually. So we exercise professionals needs to understand the progression manner in this population. So that's basically it from us. These are the references used for our presentation. And thank you.